Welcome, and thank you for joining us today. In just a few minutes, we're going to walk through our new Growing Together initiative and some of the changes we're making as a first step. But first, let's take a moment to talk about where we've been, how we got here, and why we've chosen this moment to make these changes. This journey began 2 years ago when two world-class healthcare providers joined forces to become Hackensack Meridian Health, a leader of positive change on behalf of our patients, our people, and the places in which we live and work. In the time since, we've made a lot of progress. We welcomed JFK Health into the HMH family. We established a new mission and vision to help guide our actions as one organization. We introduced our core beliefs of creativity, courage, compassion, and collaboration, which drive everything we do. And through it all, we have continued to be recognized as one of the best places to give and receive care. This journey doesn't begin and end with caring for our patients. It is also about creating an experience and environment that cares for you. That's why we're making these changes now. We reviewed our existing structure, and this is what we saw. More than 56 PTO plans, 13 payroll systems, 13 medical plans, 6 life insurance plans. Turns out, we're doing lots of things well, but we knew we could do better. Team members from across the network helped identify the strongest, most sustainable components of Hackensack, Meridian, Palisades, Raritan Bay, and JFK, and benchmark them against some of our biggest competitors and great places to work to create a new, improved package of benefits, policies, and systems. This package was designed based on 5 main goals: provide more flexibility and choice, support a great place to work culture, foster sustainable growth, help you own the decision-making process, focus on the needs of you and your families. There was a give and take from everyone, so as you are learning about the changes, we ask that you keep an open mind. While there may be some things you don't like, we think when you look at the big picture, you're going to like a lot of what we're about to show you. And remember, most of these changes do not take place until January 1st, 2019. We are sharing these changes with you now, so you have plenty of time to absorb and ask questions before you need to make any decisions. So, let's get started. Growing together is how we will define the team member experience at Hackensack Meridian Health from this point forward. It is about aligning and enhancing the benefits, policies, and systems to support each team member individually and strengthen our organization as a whole. Health and well-being, pay practice, personal time off, professional growth, retirement, policies, and systems. It is also an ongoing and evolving effort. Our journey doesn't end here. The programs and policies we're talking about here today will continue to evolve and new elements will be added. Our commitment to you is this: we will communicate these evolutions and additions as early and often as possible. In the meantime, let's take a look at how we'll be growing together in 2019. Let's start with health and well-being. We have lots of favorable changes with new options, which will allow you to make the choice that is best for you and your family. We will now have 3 medical plans available with 4 tiers to provide multiple and affordable options. Providers in Tiers 1 and 2 are members of what we call our inner circle. Tier 1 includes our very own physicians employed by HMH, while Tier 2 includes those physicians who are Hackensack Meridian Health partners but are not employed by HMH. Tier 3 is the National Horizon Network, and Tier 4 covers providers that are out of network. We've got you covered for whatever you need. The new prescription offering takes advantage of our in-house pharmacies and the value they provide. They'll be the least expensive option. Don't have access to one? We're making delivery arrangements and expanding to new locations. If you have prescriptions that allow for a 90-day supply, the single lower copayment will save you time and money. Of course, retail and mail prescriptions also provide you with additional choices. New dental and vision plans also provide several options. We've got life insurance covered, Not that we ever want to use it, but we've raised the value of this benefit to help take care of your loved ones. We've also added a few incentives. You and your spouse can earn $250 for designating a primary care physician, getting a biometric screening, and completing a health risk assessment. That's it. There are no health measurements that need to be achieved. Simply completing these 3 tasks makes you and your spouse eligible. Our coordinated care nurse managers can help you manage medical needs such as diabetes, high blood pressure, and high cholesterol. Team member tip: prescriptions related to these conditions will cost you or your covered family member $0 if you work with a coordinated care nurse manager. You'll also be able to enjoy a 20% discount on all non-pharmacy items at Rite Aids. Remember, details such as this new prescription formulary and a full list of covered services will be available soon. You will have plenty of opportunity to review the new plans before open enrollment in October. Personal time off. We want you to take and enjoy your time off, and we know that hasn't always been possible. So, we're moving to a new time off package that consists of 4 separate buckets of time. Taking off for a holiday? Eligible team members will have 6 paid legal holidays. No need to use a PTO day. Feeling under the weather? Eligible team members will have 5 annual days of earned sick leave, which can be used pending necessary requirements. This is also separate from your PTO. Out for an extended illness beyond 1 week? Our enhanced short-term disability is now built into your total rewards, which means you'll get a full 2/3 of your paycheck for up to 26 weeks. Taking time for yourself is a crucial part of building a happier, safer, and all-around better workplace for you and our patients. We want you to take time off rather than saving it for sick days or emergencies. So here are the changes coming to PTO. You won't have to wait to accrue your PTO before using it. You'll be able to use it now and then pay it back, kind of like a PTO credit card. The amount of PTO you accrue in a year will be based on your role and years of service. You'll have a maximum carryover of 80 hours of PTO per year. This does not mean your PTO is limited to 80 hours per year. Eligible team members won't lose any PTO that's already over the new 80-hour carryover maximum. Starting January 1st, 2019, you will have 3 to 5 years to use it. If you leave before then, it will be paid out. Of course, you'll still need your manager's approval to schedule it. Remember, this is a preview of how the new plan will work. Final details are under development and are being implemented under various regulations, so there may be some modifications as this process continues. Professional growth. Growing together is also about creating new opportunities for you. By aligning our performance management and recognition programs, we can foster more development and engagement to help grow your role in our success. So we're also strengthening and aligning our recognition program, which will now include traditional peer-to-peer recognition, as well as patient-to-team member feedback. Our talent management programs to better engage, recruit, retain, and grow our talented team members at all levels. Our performance management practices, forms, rating scales, and systems. Our tuition assistance offerings. The reimbursement caps will not be changing. However, there will be other enhancements to the program, administered by Ed Assist. Team Hackensack Meridian University, Team HMU, to enhance opportunities for learning and development throughout the network. Retirement. It's always important to look ahead, and our defined contribution plan will help you get there. It starts with a new automatic enrollment of 3% of your gross annual salary, which will increase by 1% each year up to 6%. Of course, you can always elect a higher amount. Then we'll place 1.5% of your gross annual salary into your account. We want you to save more, so we'll help you achieve your goals with a match that can give you up to an additional 3.5% if you save 5%. We've got lots of existing plans in place, and while most are changing in 2019, some are changing at a slower pace, subject to IRS regulations. Please visit www.teamhmh.com/retirement for more details about individual transition plans. Remember, this is a preview of how the new plan will work. Final details are under development and are being implemented under various regulations, so there may be some modifications as this process continues. Pay practice. We're going to harmonize 13 different payroll systems and multiple pay cycles. Starting in 2019, your pay date will be on Fridays. You'll be paid on a bi-weekly cycle. We're also transitioning to paperless pay, meaning no more paper checks, and no more worrying about getting mail in a snowstorm or paying steep fees at check cashing services. Starting in 2019, you'll have two options: direct deposit or a pay card. More to come on this. Systems. We're also upgrading and streamlining many of our day-to-day processes, including payroll, scheduling, and team member self-service, onto one system, MyWay PeopleSoft. Benefits of this effort include improved self-service so you can see and update your own data, more accurate and complete reporting, paperless processing and visibility as to the status of requests and approvals. You will have the ability to log into PeopleSoft and access MyWay in October 2018. Pop quiz. We've covered a lot of ground already. You're not expected to become experts, of course, but we want to make sure a few really important points don't get lost in so much change at once. Let's test our knowledge. Number 1. The maximum amount of PTO you'll be eligible for is 80 hours. True or false? False. For eligible team members, the maximum amount of PTO you'll be able to carry over from 1 year to the next will be 80 hours, but your actual PTO will vary based on your role, years of service, and other elements. Also, any PTO you have now that exceeds the new 80-hour carryover maximum won't go away. You'll have a 3 to 5 year drawdown period to use it. Don't forget, you'll also have 5 annual days of earned sick leave, ESL days, and 6 paid legal holidays. Number 2. The most affordable healthcare option is to use providers inside the inner circle. True or false? True. You'll have 3 plan options with 4 tiers to maximize your cost savings and offer more choices for how you receive care. The inner circle has 2 tiers, with the best savings using physicians and providers who are employed by us, or technically known as domestic, Tier 1. Number 3. Any money I have in HMH-sponsored retirement plans will disappear next year when the new plan is launched. True or false? So false. Any funds that you have contributed to an existing plan is yours to keep. There are vesting rules in place should you leave Hackensack Meridian Health, but again, any funds you have contributed are always yours to keep. Number 4. If I want to take some time off but haven't accrued enough PTO yet, I'll be able to use it first and then pay it back over the year. True or false? Absolutely true. Need 5 days off but only have enough PTO accrued for 2? Eligible team members won't have to wait. You'll still be able to take that time off right away and then pay back the PTO you used as you accrue more during the year. Number 5. There's nothing I need to do today. True or false? Technically, true. Your next action will be open enrollment in October, where you'll make your healthcare selection and also get set up in the new MyWay PeopleSoft system. But we hope you'll take the time to keep learning more and look out for a decision guide to come before open enrollment starts to help you make the decision that's best for you and your family. We've put some tools in place to help you understand the changes. Number 1, teamhmh.com is your one-stop shop for all information. It's regularly updated, and you can submit questions online and read many of the other questions we've received. Number 2, Growing Together workshops will enable you to hear presentations and ask the experts your questions. Number 3, talk to your HR site team. They're always here to help. Live above the line. It's a concept based on trust, support, and being committed to each other's success. It is what drove this process. We're excited about the future of Hackensack Meridian Health, and we know that you are too.